Hi, this is Dr. Miguel Torres from Modern OBGYN Care, and today we're going to talk about abnormal pap smears and a colposcope. So when you get to your OBGYN for your routine care and your routine appointment, the first thing they're going to do is a pap smear. A pap smear looks for abnormal cells, we also call it dysplasia, or to make sure that the patient doesn't have cervical cancer. If your pap smear is abnormal, the first thing you're going to be notified is that you're probably going to need a colposcope or a colposcopy. A colposcopy is a test where we actually use a magnifying glass, like the one I have here, which allows to identify the abnormal cells in your cervix. We actually put acetic acid. This allows for the cells to light up white, and when we look with the colposcope or the magnifying glass, we can identify the areas that look abnormal or that could be suspicious for dysplasia, which are precancer cells, or actual cervical cancer, which is a result of HPV. If we see the abnormal cells, we would then notify you because we will have to do a biopsy. A biopsy is a little pinch of your cervix, which allows for us to get tissue, send it to the pathology to evaluate whether or not the patient has cervical cancer, or if you have dysplasia, which type you have. So women need a colposcopy because of an abnormal pap smear. Abnormal pap smears are going to be identifying abnormal cells, or sometimes they would also tell you about HPV. We would insert the speculum, which would allow us to visualize the cervix. This here is a cervix. This is where we would take the biopsies from. This is called a transformation zone. The transformation zone is where we will usually visualize abnormal cells, and this is the majority of the pictures, and the majority of the biopsies will be done. The endocervix will be the inside of the cervix. We usually do something called an ECC, which stands for endocervical curettage, which would allow us to sample the inside of the cervix, and with the biopsy we will usually sample the ectocervix, which is the outside of the cervix. This allows for us to zoom in and out. We can also freeze, take pictures, load it into the patient's history so we can compare in the future. In our office, we can also have it connected to a monitor so patients can easily see exactly what we're looking at and where we're doing the biopsies from. These are the instruments that are usually used during a colposcopy. The first thing that is applied is called acetic acid. Acetic acid would allow for the abnormal cells to be visualized using the colposcope because they will light up in white. These would be the biopsy instrument. Once the biopsy is performed, it's placed inside a specimen cup and sent to the lab where the pathology would evaluate it. Once the biopsy is completed, we will usually apply Mons cells. Mons cells is a solution that is initially color mustard, but then it becomes coffee color and it minimizes bleeding. In some cases, we also use something called silver nitrate. Silver nitrate would allow for clotting to take place at the site of the biopsy and would also minimize bleeding once the biopsy is completed. If we identify the abnormal cells, usually what we do is we would do a biopsy. Sometimes we can do biopsies of the outside of the cervix, and we can also take samples from the inside of the cervix. We call that the endocervix. So if the results are abnormal, sometimes patients will require further therapy. One of them will be cryotherapy, which is freezing the cells. Sometimes we'll also need excision, which is actually removing some of these cells with one of two methods. One of them is called the LEAP, or another one is called the cone biopsy of your cervix. You shouldn't be worried, but it's definitely something that to discuss with your OBGYN, because if you have abnormal pap smears and you need a colposcopy, that means that there are some precancer cells in your cervix that need to be closely monitored to make sure that they never become cancer. It's not very painful. Just think about it like a little pinch of your cervix where we take a little piece, tiny little piece of tissue. It's not considered surgery because it is an in-office procedure. It's very quick. Usually it's about 5 minutes in length from beginning to end. Right after the procedure, most patients do very well. They're able to have a pretty normal life. They can drive, they can resume daily activities. But we do recommend to avoid intercourse until the bleeding stops. Sometimes patients can have spotting for about 2 to 5 days. The number one side effect of a colposcopy is really spotting right after the procedure, which can last anywhere between 3 to 5 days, and very minimal vaginal bleeding, as well as some cramping, for which we recommend taking anti-inflammatory medications such as ibuprofen, Aleve, or Advil. So thank you for watching. Please follow us on Instagram, Facebook. You can also look us up on our website, www.modernobgyncare.com, and you can always make an appointment.